The following video was made as part of the Musculoskeletal Disorder (MSD) prevention program to decrease injury risk to employees. The goal is to provide readily available access to training on available patient handling equipment. Ultimately, this should increase the employee's knowledge, which will assist when determining the correct equipment to use to complete a patient handling task. It is important to maintain the mobility of all patients during their health visit or stay to maintain and improve health. Best practice is that when completing a patient handling task, employees should not exert forces greater than 35 pounds or 16 kilograms. An assessment of the patient's abilities must occur prior to every patient handling task to determine how to best complete the task. The assessment will assist to determine the right piece of equipment, the correct amount of assistance required for the task, and to protect all involved from injury. All equipment shown in the following video can be used with one employee, but more assistance can and should be used, if required, to keep the patient and employees safe.
I've been called to take a body from upstairs down to the morgue. My first step is that I get the key from switchboard. Second, I come to get the tray and the stretcher. And I get down here and there's no tray on, so I'll put one on. I go to the yellow and black line on the floor, no farther than that, and break my stretcher. I tip this bar up and remove my hand, and I haven't lined up my stretcher properly, so I need to come back and adjust it again. When I rock it back and forth, it's on properly. If it tips, when you put the patient on upstairs and it tips like this, you'll have to take the patient back off and adjust the tray again. It has to be on the rollers and rock back and forth. Okay, I've gone upstairs to get the patient. I'm going to come back and put the body into the thing. I'm going to, again, go only up to my line, break the stretcher. I only need to move this bar and let it roll in. I'm off. I need to lift the stretcher because the body's heavier. In between those two bars, slide it in the middle, push it right in, and put this bar down. That's it. Just close the door and label.
This is a slider sheet. It will come on your regular linen cart, and it's used to help reposition patients in bed, as well to assist with lateral transfers from bed to stretcher. The advantages that the slider sheet has to using the soaker pad for repositioning is that it has a nylon backing, which is gives a lot less resistance than the felt backing of the soaker pad. The slider sheet can be used with a regular fitted draw sheet, or as well it can be used in conjunction with this fitted slider sheet, and it allows patients to slide up and down the bed and be repositioned in bed. Whether you're using the bottom fitted sheet or not, when this top slider sheet is finished being used, it needs to be tucked in underneath the mattress so that it won't continue to slide down the bed, and as well just to make sure it's free from wrinkles to ensure that there's no skin breakdown. This is a demonstration with the slider sheet system. This system will promote independence of the patient. Again, the difference with this slider sheet system is it's much longer, so it'll cover from the bottom to above the patient's shoulders, where the soaker pad is typically going to be under the patient's bottom and then only cover to approximately mid-torso. The great thing about this slider sheet, it's going to promote independence when it's here in the system. And when you put the system down, and you can ask the patient, put the side rails up, ask the patient to reach up to the side rails themselves when they've slipped down the bed, and then they can push with their legs to slide up the bed. Once the patient's repositioned, you need to take and tuck the sheet in so that the patient doesn't slide further down the bed again. If the patient has slid down the bed and they're unable to use their own strength to push themselves back up the bed, you can use two caregivers to slide the patient back up. You want to grab the sheet, slider sheet as close as you can to the patient, and on the count of 3, we'll weight shift and slide up. Are you ready? 1, 2, 3. And slide the patient back up the bed, and then if we needed to roll to reposition, you can do that and place a pillow to allow the patient to stay in sideline. When you're finished, make sure you straighten the sheet out as much as possible and tuck the sheet in so it won't slide back down the bed. These are the orange sliders. They're kept in the clean utility storage rooms. They are single patient use only and should be kept with the patient during their stay. They cannot be left under patients, as they are to leave very little resistance, and the patients could slip off the bed or if they're left underneath. When you're using them, you need to put them in the direction of the arrows. If you're transferring the patient up and down the bed, the slider would go this way. If you're doing a lateral transfer from a bed to a stretcher, the arrows need to go the other direction. We're going to demonstrate transferring the patient from the bed to the stretcher. So what you would do is push the orange slider as far as you can underneath the patient. Bring the soaker pad back down, and on the count of 3, we're going to slide you from one surface to the other. 1, 2, 3. And then you can remove the slider after the transfer is completed. This is one example of a slider board that's available. It's a white transfer board. It's slippery on one side and has rubber straps on the other side, which help prevent it from slipping. It bridges the gap between the bed and the stretcher when you're laterally transferring a patient. First, you take the board and you place it between the surfaces to bridge the gap, placing it slightly underneath the patient. We're going to bring the patient's feet onto. We're going to grab 2 people on one side, 1 person on the other, and as well the patient's pillow. We're going to move on the count of 3. 1, 2, 3. And then you can remove the board and the transfer is completed. This is a different style of slider board available. It can be used the same way as the other slider board with the black rubber straps can be used to bridge the gap to slide from one surface to the other. But the other way this board can be used, if the patient, perhaps in imaging, if the patient has a fracture and they're moving them over to an imaging table, this is how this board can be used. It could be used ideally with 2 staff. You take the board with the straps to the side you're transferring to. You're going to roll the patient and push the board under as far as you can. We're going to roll back. We need to make sure the patient is centered onto the board as much as possible. And then we're going to take the whole board and we're going to slide it over to the other surface. So on the count of 3, you're going to pull and I'm going to push. 1, 2, 3. And the transfer is complete. This is the roll board. It's a combination of the slide board and a slide tube, and it rolls around the board to help decrease resistance of when transferring a patient from one lying surface to another. It should be completed, the transfer should be completed with a minimum of 2 staff, but is usually completed with 3 if they're available. First, you take the board and you have this patient roll to the side slightly, just to get the board halfway underneath, and then move the legs back to the middle. If the patient can hold their own head, you would have them do that, or the caregiver can do that for them. On the count of 3, we're going to slide the patient over. 1, 2, 3. And then roll the patient slightly to remove the board, and the transfer is completed. This is the pivot disc. You would use it to transfer patients from one seated surface to another. There are some limitations with this using the pivot disc. One is that you have to activate the brake when the patient is using it, and you don't want to be reaching over to assist the patient. So if the patient needs assistance to stand up, then you should have a second caregiver to assist with that. The other limitation is that it only spins in a small circle, so you need to ensure that you've lined the equipment up properly with the bed and the chair. There are a few adjustments on the pivot disc. One is this adjustment, which can adjust the height of the knees, and this should be set so that it's just below the patient's knee height as well. These 2 adjustments can widen the knee supports or bring them narrow as required, and this adjustment can adjust the handle height for the patient to pull up onto. When you're completing the transfer with the pivot disc, you bring it into the patient, bring it in close. You're going to activate the brake. You're going to have the patient reach up and pull up. Once they're standing, you can release the brake and turn the pivot disc, and you can reactivate the brake, have the patient reach back for the chair, and the transfer is completed. This is the MOLIFT razor, and it would be used to transfer patients from one seated surface to another. It can travel in multiple directions and not just one circle, so you can move the patients short distances within a room. This is the knee height adjustment, and it adjusts up and down, and the height of the knees should be adjusted so this is just below the patient's knees. What you would do to demonstrate moving a patient with this lift is you would bring the MOLIFT razor into the patient, seated on the side of the bed, lock the brakes. You can bring it in, make sure the height of the knee adjustment is just below the height of the knees. Have the patient reach up, stand up. You can be at the side to assist if required. Come to this side to unlock the brakes. Move the lift over to the chair. Again, lock the brakes. Have the patient reach back for the chair and have a seat. And the transfer would be completed. This is the Sara Steady. It's used to transfer patients from one seated surface to another. The ability of this piece of equipment is it can move in all directions. It also has seats that flip behind that the patient can sit on when you transfer them short distance within the room, perhaps from the bed to the washroom. The lift itself also has the ability to widen and narrow the base to allow it to fit around furniture, and then the brakes to lock on and off. To demonstrate how to use this piece of equipment, you bring it in close to the patient, lock the brakes, then you can stand behind the patient, beside the patient to assist if they need some assistance to stand. Once they're up, you can flip the seats in behind to allow the patient to sit. Unlock the brakes. And then again, trying to transfer the patient with the patient's weight in the center of the lift. Bring it in towards the chair, widening the base as needed to get around the chair. Bring it up. Lock the brakes. Have the patient stand up. Remove the seats. You have the patient reach back and have a seat. And the transfer is completed. This is the powered sit-stand lift. It's also called the Encore or the Sara Plus. To use the lift, there's a power button that turns the lift on and off. It should be turned off when not in use, but when you go to use it, you want to turn it on. There is a battery level indicator, and it is to be noted over here once you turn the lift back on. And as you can see on this example, the lift is fully charged. This lift has a removable battery that is similar to all the mechanical floor lifts that are being used and should be replaced when the battery is low. The lift functions. The lift raises up and down, and the base widens and narrows to fit around equipment. The controls are noted on the handheld controller as well as on the lift. When the lift raises, it goes up in short sections. When it lowers, it can lower all in one bit, and as well the base can be made wider or narrower to fit around equipment. To note over here, there is a knee support that helps brace the patient's knees. It can be raised and lowered as required, but the height should be adjusted so that this is just below the patient's knees. The patient's feet stand on the foot plate, and their hands and arms rest here on the top of the lift. The sling is attached to the lift via these straps, which I will show in the demonstration. This is the sling that you would use, and there are different sizes available. The sizes are noted here on the top of the lift, and also can be noted the same color matches on the sling. When you apply the sling to the patient, it wraps around the patient's waist, and you do want to make sure that when you cross it over, you pull it snug, not too snug, but it should cross past the green line here to make sure that there's enough Velcro to support holding the sling in place. You're going to bring the lift in towards the patient, ask the patient to raise their feet and put their feet onto the foot plate, and bring it as close into the patient as you can. You can lower the lift down, and we're going to first connect. I'm going to have someone come and assist me with this lift. We're going to take the toggle straps. This is the most complicated part of attaching it to the patient. You're going to take the toggle, put it through the strap, and then into the cup. And then you're going to pull the strap tight and let it hang down. Ask the patient to reach forward. Then we're going to explain to the patient, we're going to have you stand up. The lift is going to stop periodically as you stand, but we're going to try and raise it as fast as we can. Once we get you standing, we'll turn you so that you can have a seat in the chair. Okay, we're going to lift you up now. Once the patient gets into full standing, you can tighten the straps just to relieve any slack. I'm going to take the lift, I'm going to turn it. We can widen the base so that it fits around the around the chair. Bring the lift in till the patient's knees are against the back of the chair. And then we're going to lower the patient back down to have a seat. And the lift is completed. Then you can loosen the straps, pull the entire cup, take it out. You can remove the lift. Ask the patient to scoot back in the chair if they can, and then remove the sling. This is one of the styles of mechanical floor lift. This is the Opera. It is also similar to the Tempo floor lift. It's just an updated version that has height adjustment. The Tempo lift does not have the height adjustment, but operates the same way. This one also has a different feature, which I'll mention in a minute. To turn this lift off and on, again, there's the power switches here, and the lift should be off when in storage and on when you're ready to use it. It has, again, removable battery that should be replaced when the battery is low. Once you've turned it on, you can check the battery power by pushing one of the buttons, and you can see in the battery level indicator that this battery is fully charged. The hand control features are also here on the equipment, and they allow the lift to raise and lower, and as well to control the base, to widen and narrow to fit around equipment as required. Ideally, when you move a lift, when the space allows in a room, it's ideal to keep the patient's weight centered under the lift and to move the lift around the patient and then push in a straight line, rather than you fixing your feet and trying to move the lift, as that causes a lot of physical strain on you. The extra feature that this lift has is it has a power tilt feature, and this feature allows you to angle the patient if you're moving into a sitting position or a lying position to better position the patient without requiring physical effort by you to complete the task. So first, when you're going to use the floor lift, you have to apply the sling. So we're going to move the patient from lying to sitting. So first you want to raise the height of the bed so that it's approximately waist level for both caregivers. You're going to roll the sling. You're going to be rolling the patient to place the sling underneath so that the base of the sling is at approximately the patient's coccyx. The patient rolls to one side. Place the sling under the patient as far as possible, again with the base of the sling at approximately the patient's coccyx level. Have the patient roll back and then roll slightly to the other side to pull the sling through and ensure the patient is centered on the sling. Next, you take the leg straps and you place them underneath the patient's knees and try and ensure that they're not bent or crinkled. Next, you'll bring the lift in. And these are clip style slings, so they attach to the lift onto the clips. You can lower the lift to get each of the clips on. Attaching the legs first. And again, on this lift, it is power tilt controlled, so you can angle the lift to attach the top clips. Once the patient is in the lift, you can raise the patient up slowly, making sure there is no pinch points on the sling and that the patient is comfortable. Since we're going to a sitting position, we move the patient up to sitting first and then raise the patient till they clear the height of the bed. And then you can pull back on the floor lift. Again, try to turn the patient, lift around the patient as you move it on the floor, and then try and push it in a straight line back towards the chair. Or bring the chair forward to come under the lift, widening the base of support as required. And then locking the brakes on the chair or ensuring you're holding it so it's not going to move, and lowering the patient down. Once there's enough slack on the sling, you can undo the clips of the lift and remove the lift from in front of the patient. After this is completed, you need to remove the leg straps from underneath the patient. And if you can easily do it, have the patient lean forward and remove the entire sling from behind the patient so that it will not cause any pressure points. And the lift is completed. If a patient does not have proper neck control, you can insert these plastic stays into the sling, and this will help assist the patient's control of their head and neck during the transfer. So when you're moving the patient to the bed, you take the sling and you place it down behind the patient, asking the patient to lean forward. Just placing the the sling down to the base of the chair and then pulling the leg straps along the side. Have the patient lean back, pull the leg straps tight, and then down and underneath the patient's knees. Trying to take up any slack that is available. Once that's completed, you can bring the lift in and then attach the clips of the sling to the lift. Attaching the leg ones, and then you can tilt and attach the shoulder clips. You can raise the lift slowly, ensuring the patient doesn't have any pinch points on the sling. Again, trying to pull the lift back, rotating the lift around the patient. And moving the patient back over top of the bed. Once you get the patient over the bed, you can assist with the legs if necessary and have the patient centered over the bed. Then you can lower the lift back down until the patient's weight is supported by the bed, and then you can adjust the angle of the lift to allow the patient to recline into a lying position. Once the patient's weight is supported completely by the bed, you can undo the clips from the sling from the lift. And then you can remove the lift away from the bed, and then you will need to roll the patient to remove the sling, as the patients cannot be left lying on these slings as it can cause skin breakdown. And the lift is completed. This is the Maxi Move mechanical floor lift. It is very similar to the Opera and the Tempo, but it is the updated version. The advantages to this lift, it has a lower lifting height, can go right to the floor, and has actually a higher lifting height as well, so you can get more bed clearance. This lift has a power on and off switch and a removable battery. When you turn this lift on, there is an LCD display here on the handheld controller, which indicates the battery level. As well, you want to make sure you turn this lift on before use because the scale that is integrated within the lift needs to be set to 0, so you don't want to have any sling or any patient weight on the lift. All the functions to operate the lift are here on the handheld controller as well as on the mechanical lift. The lift height can raise up and down, and the base height can widen and narrow to fit around equipment as required. The other difference with the Maxi Move lift is that this lift does not have a power tilt and needs to be adjusted manually to angle the patient. So first, when you're applying the sling, you want to roll the patient to one side and then tuck the sling as far under as possible. When you're doing this, you want to ensure the height of the bed is approximately at the caregiver's waist level. You roll the patient back onto the sling and then roll the patient slightly to the other side, pulling the sling the rest of the way through, trying to ensure the patient is centered on the sling and the bottom of the sling is at approximately the patient's coccyx area. Next, you're going to take the leg straps and bring them underneath the patient's knees, ensuring that they don't have any folds in them. Bring the lift into the patient and attach the lift clips onto the carry bar at the knees, and then tilt the angle and attach it on the shoulders. And you're going to raise the patient up adjusting the angle that the patient is sitting on as needed. Bring the patient up enough just to clear the bed, pull the lift straight back. And again, moving the lift, trying to rotate the lift around the patient, and then move it again in a straight line towards the chair. Widening the base if necessary, bringing the patient over the chair and then down to the sitting position, holding the chair with your legs and hopefully applying the brakes. Once you get the patient down comfortably to the seated position, you can unhook the clips on the lift and remove the lift from in front of the patient. Next, you want to take the lift sling out from underneath the patient's knees, ask the patient to lean slightly forward, and remove the sling from the patient. If you were transferring the patient back into bed, you would take the sling, put it down behind the patient, taking the sling, the base of the sling right down to the chair level, as far as you can do comfortably, pulling the leg straps down along the side of the chair and underneath the patient's knees, ensuring they are not wrinkled. Bring the lift in again in front of the patient, attaching the clips onto the carry bar. Once they're attached, we are going to raise the patient up, adjusting if necessary to ensure there isn't any pinch points on the sling. When you think you have the lift high enough, you can again try and move the lift in a straight line or turning it around the weight of the patient. Getting the patient centered over the bed. And then lowering the patient down into the bed, adjusting the angle of the carry bar as necessary to allow the patient to recline. Once the patient's weight is absorbed by the bed, you can unhook the sling from the lift, remove the lift, and the transfer is completed. This is the Tenor bariatric lift. As you can see, it has a much higher weight capacity than the other floor lifts. It has very similar functions. It has the same on and off, power on and off control here, the same removable battery. It has the handheld controller, which you can raise and lower the lift and widen and narrow the legs to fit around furniture as required. This lift also has a scale on it, and the functions for the scale can be operated here underneath. This is the carry bar. It is different from the other lifts, is that the wide part goes to the shoulder and the narrow part goes to the knees. As you can also see, this requires a different type of sling than the clip. This is a loop sling. The loop sling, when you have it, you always want to make sure whichever loop on the sling that you use the same loop for all four corners of the sling. So if I was going through the second loop here, the other thing you don't want to do is you don't want to just put it only through the loop, but also put the entire strap through, just for further protection for the patient in case there was something happen to this strap and it would give out. When you hook the lift, use the sling to the patient, you take this top part to the patient's shoulders and head area. Okay, and then the base of the sling would be at approximately the patient's knee level. It kind of hugs the patient in and offers a bit more support than the basic clip style sling used with the other lifts. This is the mechanical ceiling lift. It is used to take patients out of bed to chair or return them back. This is an example of a straight track system, and when you are using it, you want to make sure you line up the furniture you are using underneath the track so that the lift can move straight up and down. There is a handheld controller. On the handheld controller, it operates the up and down functions of the lift, and as well as it drives the patient along the track. You don't want to be pulling the lift, as that is against how the lift should function. You want to be using the arrows to push the lift along the track. This dark arrow corresponds to the dark arrow on the ceiling lift, and so it moves the lift that direction, or the white arrow the other direction. When you are finished using this lift, it has a return to charge function. You can push this option on the lift. It will raise the lift, take it back to the battery charger where it can be left for storage, and ensure that the battery is fully charged for the next use. This red cord is for emergency lowering, and you would pull this if the patient was stuck up in the lift and the battery wasn't functioning properly. This is a demonstration taking a patient from lying to sitting using the mechanical ceiling lift. So first you want to adjust the height of the bed so that it's equipped for both workers at their waist. Then you want to roll the patient slightly to place the sling underneath the patient. Ensuring that the bottom of the sling is at approximately level with the patient's coccyx, and the patient is centered on the sling. Once you get the sling underneath, you roll the patient slightly to the other side and pull the sling through. Then you can take the knee straps and take them underneath the patient's legs, ensuring that they are not twisted or tight. Then you can bring the mechanical lift down using the hand controller. First, you have to remove it from the charger. First, you remove the lift from the charger and then lower the lift for use. First, attaching the leg clips of the sling to the carry bar, and next attach the shoulder straps to the carry bar. Once the sling is clipped in, the lift can be raised up, ensuring there are no pinch points on the lift, and the lift can be tilted for patient comfort while lifting. Once the patient's bottom clears the bed, you can drive the lift along the track so that the patient is over the chair. Ensure the brakes of the chair are on and you're supporting those, and lower the patient down into the seated position, assisting with the tilt of the lift using the carry bar. You can unclip the lift from the sling. You can push the return to charge button and take the lift back to its base so that it can be charged. While it's doing that, you can remove the sling from underneath the patient's legs. Ask the patient to lean forward slightly and remove the sling from the patient's back. And the lift is completed. This is a transfer back to bed using the mechanical ceiling lift. First, you take the lift out of the charger and bring it over the chair. Next, you take the sling and you take the base of the sling down to the chair level and just tuck it slightly underneath the patient's bottom, pulling the leg straps straight along the edge of the chair and then underneath the patient's knees. Next, you want to bring the lift down and drive it to the right place over the patient, and then bring the lift down so that you can attach the leg straps to the carry bar. And then you will attach the shoulder straps to the carry bar. Once the sling is attached to the lift, you can raise the lift, ensuring there are no pinch points on the sling. And the patient has their arms within the sling. Can lift the lift back up enough to clear the chair and for the patient to clear the bed. Drive the lift along the track until the patient is centered over the bed. Then you can lower the lift back down, tilting the carry bar into a reclined position, and unhook the sling from the carry bar. Again, you can push the lift to the return to charge position when the lift is completed, ensuring that the handheld controller is going to stay attached to the lift. Then you can roll the patient slightly to remove the sling from underneath the patient. And the lift is completed.